Well, thank you very much for joining us this morning for STIs 101. I'm Naomi Verrett. I'm a Health Promotion Officer with the Caddyshack Project, predominantly based down in the Shoalhaven area. And this morning I'm joined by Naomi Hoffman. You've got the two Naomis this morning from the Sexual Health Clinic, predominantly based in Port Kembla, also visiting Nowra occasionally. So welcome to STIs 101. Thank you for joining us this morning. We would like to begin this morning's session by acknowledging the traditional custodians of the land upon which we meet. For Nay and I this morning, we're meeting here on Dharawal country, and we would like to acknowledge elders past, present and emerging, and welcome all of our Aboriginal and Torres Strait Islander clients who are joining us, colleagues, not clients in this role, our colleagues who are joining us this morning from across New South Wales. So thank you for being here. We're going to kick off, and some of you may have joined this morning thinking, oh, STIs 101, it's going to feel a bit high school, feel a bit uni-like. It's the kind of topic code that you would probably see if you've ever attended uni. But we're actually going to mix it up a little bit this morning, and it's going to be sort of a Nay and Naomi on the couch, having some conversations around STIs and what we're currently seeing. So first up, what is an STI? Have you got some insight for us, Nay?
Yes, I do, absolutely. Good morning, everyone. So an STI, those words stand for Sexually Transmissible Infection. In the past, people used to call them STDs, but we call them STIs these days. There's quite a variety of STIs, and I have some little plushies here to help me explain what's what. Basically, they kind of break down into a few different categories. Most common, bacterial STI. So a sexually transmissible infection is something that can be passed from person to person through sexual contact. Many of the STIs, the bacterial type, it's possible that if left untreated, can get up and cause inflammation, fertility problems. Some can cause symptoms like burning when you wee, while many can have no symptoms at all. So we're going to talk just briefly about some of them because we have a lot of questions to go through today. So your bacterial infections, your most common bacterial infections is, here we are. We've got our little chlamydia and our little gonorrhea. You can hold them closer. These are called giant microbes. That means this is what they kind of look like under the microscope. So we've got chlamydia and gonorrhea. They're our most common bacterial infections, especially common in young people under the age of 30, but we see them in many different types of groups of people as well. Often no symptoms, but like I said, can cause the burning when you wee, spread through unprotected sex, but we get into that a little bit later. Unprotected sex meaning sex without a condom. So we also have syphilis as well, comes into the bacterial family. However, it's a little more uncommon, but lately we have been seeing higher rates of syphilis out there, which keeps me very busy, unfortunately. Yeah. We also have virus type of sexually transmissible infections. So we have this one, I believe, is the herpes one. Yes, I'm right. I remember my giant microbes. We've got a herpes there. That as well can be spread through sexual contact. We've also got is this one the HPV? Yes, it is. Another virus. I do. So HPV, that can also be spread. Whilst we're talking about these different infections, I don't want people to think that sex is bad or anything like that. We're totally pro-sex, but it's about being aware of the things that are out there, the appropriate tests to have and to get checked. We also have sexually transmissible infections also kind of include some other things which can include other viruses that aren't just spread through sexually transmitted ways, such as, for example, HIV and other sort of bloodborne viruses as well, such as hepatitis. So they can be spread through other ways, but can also be spread through sexual contact. We do have a little HIV one here. Here he is. I don't know if we have a hepatitis, but these are our little giant microbes. So we've got quite a few here. We've got quite a handful of things, a handful of bugs. So a lot of people don't know there's so many bugs out there. But there is also a small proportion of other considered STIs, like this little mite here. We've got a pubic lice. So these actually are pretty exciting things. I'll let you show him. That's really what they look like. They've got those fantastic little hooks on their legs that really hook into that pubic hair. I've seen it many times. I live for it. And we've also, got other things that can be passed through sex, such as scabies. We do see that from time to time. Have I missed any?
I think you've done really well.
I think I've covered them. Yeah.
The other thing to remember is that the genitals are a nice, warm, moist environment.
Yes.
So some people will often say to us, oh, I've got this rash or this lump or bump, and they just automatically assume that it's been sexually transmitted because it happens to be in that genital or anal area. And our advice to anyone would be, if they're experiencing any signs or symptoms in their genitals that would not be what they would consider normal or not something that they've experienced before, the best thing to do is go to a GP, the sexual health clinic, or a women's health nurse and have that checked out, because the last thing we want is for that to progress and become something that's more concerning for that individual. And Nays really hit the nail on the head in terms of those STIs, most of them not having any signs or symptoms. So other than going for those regular sexual health screens, there may be no way for that individual to actually know that they have a sexually transmissible infection present. So if in doubt, go get a test.
Oh, yes, it's easy. And we're friendly.
As you can see. Okay, we might go on to our next question. So our next question is, koalas get chlamydia, right?
They do.
Whenever we do a health promotion session and we say, have you ever heard about chlamydia? The first thing most people say is, yeah, we've heard of chlamydia. Koalas get it. So can you shed some light on that for us, Nate?
Yes. I actually do know of someone who's a bit of an expert in chlamydia and koalas.
Woohoo!
So, very interesting. Koalas can get a type of chlamydia. It's not the human type, though. So it is a totally different strain. However, it is sort of under the same family of chlamydia bacteria. However, no need to worry. If you ever know someone that's get diagnosed with chlamydia, it doesn't mean they have anything to do with koalas. So it is chlamydia, the most common STI that we diagnose and that we see. But rest assured, it's got nothing to do with any koala activity.
That's so good to know, because a lot of people will say, who had sex with a koala?
Yeah, that's right. They do think that. Yeah.
And I think the confusion often comes too because we know that chlamydia can make koalas quite ill. It does make them go blind in a lot of cases, I believe, because of in their eyes. And people say, oh, does that lead to koala death? Which potentially it could. And they therefore think that those similar signs and that fear of death can be in humans. Is that the case?
No, absolutely not at all. So when people get chlamydia, almost the whole time it's going to be in the genitals, very rarely in babies born. For women who are infected with chlamydia at the time of birth, they can get it in their eyes or can get it in their lungs. We treat that with antibiotics and they're right as rain. Same with the chlamydia in their genitals. We give you some antibiotics and it's easily sorted out and all gone. If left untreated, you can get the pelvic pain, or men can get pain in their scrotum, but definitely no death or anything like that. It's very simple treatment.
And I think you've touched on a really good point there, Nay, which is that pelvic pain and the fact that if chlamydia goes left untreated, it can lead to infertility. Is that in both males and females, or just females?
So both males and females. The way that I explain it to, more commonly, I find that females are more likely to get to that higher end of pain and discomfort because the organs are all on the inside, where the men's organs are all on the outside. They seem more likely to get symptoms than females. However, what I like to explain it as, the fallopian tubes, if we remember, we've got doing it upside down, we've got the uterus here, we've got the fallopian tubes. This is like a highway for the egg and the sperm. If we've got great inflammation and scarring going on from chlamydia, it can block up those highways. And the same thing for men. They've got the epididymis there, those tubes that are the highway for the sperm. The inflammation can get in there and block up that highway and cause scarring. So it's really important to get that stuff treated as soon as you get diagnosed. Get the routine testing done so you don't end up having these problems down the line.
And I guess with chlamydia, like you mentioned before, the bacteria are what we're seeing most commonly in a clinical setting, and particularly with young people aged 15 to sort of 29.
Oh, yes.
But we also say people don't just stop having sex when they turn 30. It is impacting those older age groups as well. And one of those main reasons being that quite often we call chlamydia the silent STI because it is often asymptomatic. So
that's right.
I guess a few people coming into the clinic and testing positive for chlamydia, there's probably some that don't have those signs or symptoms
Absolutely.
at all, right?
Yes, I make many surprised phone calls on the weekly.
So the only way, like we mentioned before, to truly know is that you're getting that regular testing done.
So I can see somebody's asked a question there. Untreated STI cause cancer. So most STIs have nothing to do with cancer at all. The only problem we sometimes get is with the human papillomavirus. That can change cervical cells, which is on the cervix in women. And if you don't get your regular pap smears, that can sometimes become quite problematic. Abnormal cells develop down the line. There can be some cancerous changes, but that's rare circumstances. If you keep up to date with your pap smears, then we don't need to, you're not going to progress to cancer, they just keep up to date. We have the Gardasil vaccine now, which helps protect against many different strains of HPV cancer causing strains. So for the general answer, no, but HPV, just keep up your pap smears.
Excellent. Thanks, Nay. And that's a really good reminder that if you have any questions throughout this morning's session, please don't hesitate to pop them into that chat box for Nay or myself to answer. If you wouldn't like to ask it as part of the greater group chat, you can just send it privately to us by clicking on that chat function and scrolling down to private. Choose the person you'd like to send it to. We are the Caddyshack Project, or Jen can get that through to us. You can ask privately, and obviously after the session you can also get in contact with us via email and we can answer any of those questions that you might have as well. Okay, next question.
Oh yes, Jen just popped in the chat about the new cervical screening test. That's the formal name. Sorry guys, I use the old name still, pap smear. But the cervical screening test is a new name and it's a far better test. So have a look at what Jen's popped in the comments there.
Excellent. So also when we do sessions, we talk about other types of STIs and what have you heard of? And people always say AIDS. Not very many people refer to it as HIV.
Yeah.
Any light on that, Nay? Do we still see AIDS? Does AIDS even still exist?
It's a great question. Basically, AIDS stands for acquired immunodeficiency syndrome. And basically that means, long story short, somebody can acquire HIV, the human immunodeficiency virus. If that virus is left untreated, on average to 6 to 10 years post-acquisition, they will develop the immune deficiency, where their immune system is unfortunately so impaired that they can get sick with other bugs that kind of jump on board. We used to see that a lot in the past, unfortunately, because we didn't have very good treatments. People were diagnosed very, very late. And so we would see a lot of people in the AIDS stage of HIV. However, now we've got fantastic treatment. People don't progress to AIDS anymore. They just they live with HIV healthily. Their immune system does not get affected. So we don't see much AIDS anymore. However, a small percentage of people, unfortunately, they don't get tested for many, many years, get very sick, and we find them then. But that is only a small percentage of the people that we actually see. So AIDS itself is not considered a separate bug than HIV. HIV is the bug. It's just it can progress to that later stage. But like I said, people with HIV these days, they take medication every day, live a long, healthy life. So we don't really see much AIDS anymore, which is fantastic, at least in Australia. In some third world countries, it's a different story. But here in Australia, we are very lucky to have such good medical care.
Absolutely. And are you able just to shed a little bit of light on PrEP for us, those of us who may not have heard of that as a form of preventing HIV?
Absolutely. So PrEP is an amazing medication. It stands for pre-exposure prophylaxis, which are fancy words. So pre means before, exposure is, it's pretty straightforward, but a possible that's another word for exposure. A possible acquisition, a contact. Yeah, that'll
HIV,
do.
Yeah.
So before the contact, and prophylaxis means kind of protection. So what that means is it's a medication that got listed onto the PBS just a couple of years ago. People who are at high risk of acquiring HIV, which tends to be men who have sex with men, people in relationships with HIV positive people, and some transgender people can actually take a pill every single day, and that not 100%, but very, very high percentage chance protects them from HIV. So how women will take the contraceptive pill to prevent pregnancy, people at risk of HIV can take their pill every day to prevent acquiring HIV. And since the introduction of PrEP, we've seen some of the lowest rates in HIV that we've ever seen. And it's a fantastic, great medication. And if you know people who may be at risk, or if you are interested yourself, I know Jen has posted the link in there about how to get yourself or how to help someone get onto PrEP. GPs can prescribe it, sexual health clinics can prescribe it. It's very easy, very straightforward. So have a look into it.
Wonderful. Thank you so much. And it was actually really interesting. The other day, we're doing a health promotion session and somebody openly disclosed that they were taking PrEP. And that person actually came to me in the break and said, who's got the most HIV? Like, out of all the population groups, who has the most HIV? Who does it impact the most?
Yeah.
And I said, well, worldwide, it's actually women and children.
That's
and
right.
He was like, I knew it. I knew I was right.
Yeah.
Whereas that's not typically our experience in Australia. Typically in Australia, it is men who have sex with other men. But worldwide, we know that the HIV virus does impact largely women and children because of those sub-Saharan African countries, typically that Nay mentioned earlier. So we are so fortunate in Australia. We do have wonderful prevention strategies through the use of condoms and PrEP, great testing opportunities, often free through those publicly funded sexual health clinics. And then also if somebody does test positive, getting them onto treatment sooner rather than later. So Nay, did you want to talk about undetectable equals untransmissible? Is that still a thing with antivirals?
Still a thing. So we've come so far in HIV treatment and it's so exciting. We've gotten to the point now where when someone starts on HIV medication that they take every single day, usually within 12 weeks of initiating that medication, their virus level drops so significantly that we can't find it in the blood test, which we call that undetectable. And it has been proven again and again and again in scientific studies that when a HIV positive person is undetectable, their viral level is undetectable in their blood, they're actually not infectious to people. So they can't infect a partner, even if they had unprotected sex, their partner's not at risk. It's an amazing time. It also means that, women can get pregnant, have babies that are HIV negative. And that's what keeps their health so good for so long. It's pretty amazing. We always have to, we're always coming up with new things. They're now talking about HIV injectable treatment, which will help some patients that have issues with medication compliance to stay on the injections so that their viral load will stay regular and suppressed. The key to we call it U equals U, so undetectable equals untransmissible. The key to U equals U is great medication adherence, regular checkups, checking the blood test, and great education and knowledge that U equals U.
Absolutely. And that just to reflect that just because that virus is undetectable in the blood, in those blood tests, it doesn't mean that the person no longer has HIV.
Yeah.
They will always be HIV positive. It's just that they don't have enough of that virus present to then transmit to other people. Because I think there's a little bit of confusion out there in the community about that undetectable viral load. Does that mean I don't have it anymore?
Yes.
And that's not the case.
No, that's not the case.
But like Nay said, really good times for HIV in Australia. But we'll probably touch on a little bit of the flip side of PrEP and what has happened when we get to some of the questions a little further along. So next up, we have, and interestingly, one of those little newspaper articles back there was from Port Kembla back in the day around the AIDS clinic. So we really dug back into the archives for that. So I'm going to bring back our little friend.
Here he is. Here's the bigger one.
This is one of our bacteria, syphilis, but it does act a little bit differently to chlamydia and gonorrhea in terms of presentation, doesn't it, Nay? And we have, as you mentioned, seen a bit of an increase in things like syphilis, particularly within the heterosexual population.
That is correct.
So males and females. Are you able to talk to us about that?
Question about depot PrEP. No depot PrEP at the moment, although depot PrEP may be coming, but depot HIV treatment is starting now. And it's sort of trial phase at the moment, but it's been proven. It's sort of just initial people. Next year, though, we'll be able to sign people up to get it, just through routinely. It's called cabotegravir. That's the main drug they're going to use. So it's pretty exciting.
Excellent. Well done. Thank you. So we're back to syphilis, our little friend. Bacteria, like Nay mentioned, but as I just said, we're seeing a little bit of a spike in syphilis, particularly within the heterosexual or male-female population. So are you able to let us know what syphilis is?
Yes.
I guess the 3 different stages, because we really see syphilis in a few different forms.
Yes.
And why we should be thinking about talking to our heterosexual clients a little bit more around syphilis and the risk, as well as, the whole community. We need to be educating the whole community, regardless of that sexual or gender orientation, I think is a really key important point that we need to make.
Yeah. Look, syphilis, they used to consider it something of the past. Syphilis has been around for a very, very, very long time. It's an interesting infection because, like Naomi mentioned, it doesn't behave like the other STIs. It's a little bit different. Syphilis itself, there's many different sort of categories of syphilis, but it's all the same one infection. It just depends on how long the person's had it or how they've acquired it, and we'll talk about that in a sec. So basically, syphilis can be spread through unprotected sex, even unprotected oral sex. It's possible. It can be spread from mother to child while the mother's pregnant, can be passed to the baby. And I've had quite a few pregnant women lately with syphilis, which I would not normally have. So that's been something I've been keeping an eye out for. It can also be spread through sharing tattooing needles, sharing injecting equipment, sharing steroid injecting equipment. It's all pretty, that sort of blood to blood, but also sexual contact, mother to child. When somebody first gets syphilis, they can get a small painless lesion or sore, which we call a chancre. After that, and that may be up inside the vagina if it's a female. So that if it's painless, they're not going to notice it's there. So don't always count on the sore to appear. You also tend to, a few weeks later to a month later, you can end up getting a full body rash or a rash to your palms of your hands, soles to your feet. Not everyone gets that. After that, it sort of goes without signs, it can be, for quite some time into sort of a more dormant stage, so to speak. So we have, if you have the sore, we call that primary syphilis. If you have the rash, we call that secondary syphilis. You kind of progressed along. We also have a look at your blood results if you've ever had syphilis before, because you can get it more than once. A lot of people think you can't. If you've had it for an unknown duration of time, we can call that latent syphilis. You might have had it 20 years, who knows? So, latent syphilis. Then if you're unlucky, the syphilis can actually get into your nervous system, your neurological system, affect hearing, vision, memory. And in that time, we'll call it a neurosyphilis because it's affecting your neurological system. And then, of course, you can have congenital syphilis, which kind of gives the name away. It's when a mother's given it to the baby. So it's quite a nasty disease because it can cause significant birth defects, whereas chlamydia, gonorrhea, it's more of just a concern. Well, it can cause some early issues and inflammation, but not so much birth defects, whereas syphilis can cause birth defects and can be absolutely terrible. And not to mention, if you're getting the memory problems, we typically do find quite a lot of syphilis that way. People present to the GP, they're getting a bit older, they're having memory problems, GP does a test, finds syphilis, and they've had it since, possibly birth or since a Thailand holiday when they were 20 years old. So that's the main things with syphilis. Syphilis is mostly treated with penicillin. So we can treat it. It's totally fine. We can treat it mostly with penicillin. Depending how long you've had it or if you have neurological symptoms, depends on how much treatment you receive. So it is a nastier infection of the lot.
Yeah, and seeing an increase of it, as you mentioned
before.
Yes,
absolutely. And we are seeing more increasing. In the past, we'd see more syphilis in men who have sex with men, but we are seeing it a lot more now in heterosexual people, which is quite new to us. It's something we've seen more even during COVID. You think people might be social distancing. I think they're using their spare time to get up to other activities. So we're seeing more syphilis than ever. So please be please be alert about that one. It's not an old disease that's disappeared. It's coming back.
Yeah. And I know that some of our Aboriginal communities within the Northern Territory and parts of Queensland have seen quite significant increases in syphilis. Is that a concern for us here in New South Wales?
Yeah, I mean, it definitely is a concern. If we're seeing anything in the country, we do get quite worried about it. The increase in syphilis, especially if we're seeing congenital syphilis, mother to child, congenital syphilis is considered a marker for poor health. It's like what you'd say, is this country's health doing good? If you have congenital syphilis, it's not very good. So it is quite concerning. A lot of Aboriginal people can be quite transient, move around. So we do worry that might be affecting us. I have seen pregnant women lately. I have seen more women So, I really feel for the guys up there in the Northern Territory. I believe it just started, it was about, 6 years ago, it started in 2 cases of syphilis in the Northern Territory, something like 6 years, could have been 8 to 10. 2 cases in the Northern Territory. Contact tracing couldn't really be done. Now we've got it out the window. So,
really
it's very sad.
And I think you touched on some really good points there, Nay, around the importance of antenatal care. So if any of the clients who you're working with present as pregnant, it is important to get them into that antenatal care as soon as possible, because that's when those screens are being done. And it's true that syphilis, HIV, hepatitis are all routinely screened for as part of antenatal care. We're yet to see chlamydia and gonorrhea be made mandatory, aren't we? And I think that out of all the possible STIs that women may have during pregnancy, it could very likely be chlamydia or gonorrhea, and pregnant women are so often providing urine samples, so make sure that you're letting those clients know to ask for those chlamydia and gonorrhea tests, as well as the ones that are routinely done as part of that antenatal care. But important that we don't forget about little syphilis, and that we are reminding our clients and the people who we're working with about the importance of screening, particularly for these types of ones where those symptoms can quite often be missed. So that regular routine screening becomes incredibly important. And I guess just on talking about regular or routine screening, Nay, what would we be considering like for regular, depending on obviously our circumstances and our risk factors, but what would you be recommending for people?
That is the tricky part. It does depend on everyone's circumstances. I like to tell my patients that testing is not a cookie cutter system. It's not one cookie cutter for all. It's an individual system. Everyone has individual practices, individual potential risks. So, we factor all these things in. People who are under the age of 30, it's really good at least to have one test a year, minimal. If people have a new partner change, go and get a test. It's so if you get out of one regular relationship, get a test. You don't know what happened at the end of the relationship. If you're about to start a new relationship, that's a great time to have a test, because I've had patients that are 3 months into the relationship and go, we found an STI. Was this before or after? Is someone cheating? To avoid all that drama, just go and get tested before you get into a relationship. That's a really great tip. Any sex overseas, especially places with higher rates of STIs, more developing countries, really great to get a test when you get back. If someone rings and says, I found out I've got chlamydia, of course, get a test. If you have symptoms, get a test. For people in a slightly higher risk category, which can often be men who have sex with men, if they're having more than 10 partners in a 3-month period, we'll recommend 3-month testing. That's a really good idea. However, if most people are on PrEP, a lot more people are on PrEP these days, and PrEP recommendations is to screen every 3 months. So it ties in with that really nicely. So that's my recommendations around testing.
If in doubt, get a test.
yes. If in doubt, get a test. Won't hurt.
Excellent. So moving right along, syphilis. And like you said, things that we thought we had literally put to bed and didn't have to worry about anymore are certainly making a comeback. So I think that because of COVID, we've all become quite familiar with that contact tracing process and the reportability of viruses. We know that some of these STIs are reportable to public health. Why is that the case?
Yeah, that's a great question. So some STIs, such as syphilis, such as HIV, can do a lot more harm to people than some other infections. And so we really have to keep an eye on that. In the way it works, for example, is if someone goes and gets a test, if the result is a syphilis positive or a HIV positive, that result will go to the local public health unit, and they ensure that everything is done properly to look after this patient. So it's really for the patient and also for the whole community. So when we have a new patient like that, the patient comes to us or to their GP. We go through making sure they're properly treated. We make sure contact tracing takes place. So as Naomi mentioned, contact tracing, we've all become familiar with those words now. It's something I've been doing for many, many years. Basically, like I said with the syphilis in the Northern Territory, what starts out as a few small cases can become enormous if we don't know, or we don't find out who the partners are and get them tested and treated. So that's another reason why we have notifiable conditions. Another reason too is to have a look at if there's epidemics happening. If we're having so many cases in this one location, that tells the government you need more funding there, you need more services there, maybe you need more education there. to stop this issue from becoming bigger, and especially these conditions that can do so much harm, like birth defects, considerable health problems, we really have to make sure that they're being managed properly and we're keeping an eye on them. So it's not about keeping an eye on the individual, but keeping an eye on the disease and the statistics and how it's all going in the community.
And what details of the individual are actually reported to public health? Do you know what those details are? Just in terms of privacy and confidentiality, if people are worried about what's going to be reported?
Yeah, so look, most of the reporting is about, unfortunately, it's a bit about categorizing people into what kind of categories they fit into. So some of that information is where we think they acquired it. Did they acquire it overseas, or did they acquire the infection in Australia? Another question they often ask is the sexual partners, the gender of the sexual partners. They do like to ask that. They also like to ask if the person's involved in any sex work at all. So it's kind of questions around that. If the person identifies as Aboriginal or Torres Strait Islander, those are the main questions that they kind of ask us, just to try and see how the statistics are going. And then that way, it kind of reports back, helps them understand where funding might need to go or where issues are maybe developing in the community.
Great. And I guess just touching on that the importance of partner notification or contact tracing. Say you've treated somebody with chlamydia, what would you recommend them do, or how do you try to assist them with that partner notification or contact tracing process?
Yeah, absolutely. So chlamydia, different STIs have different timeframes that we go back for contact tracing. So I think we know with COVID, last I knew it was 2 weeks, I think. But with chlamydia, it's actually 6 months, and that's a long time. So I talk to the client and say, look, the time frame is 6 months. It's really quite useful. What we can do is we can do it anonymously. So if you give me the names and numbers, I can do the phone calls for you. We don't mention who you are. It doesn't matter to the contact tracing process. Or there are some websites we can use, such as Let Them Know, Drama Down Under, where me and the patient or the patient themselves can send some anonymous SMSs that just go to the partner and say, hey, you may have been exposed to chlamydia and need a checkup. You can find the links in the chat there. They're fantastic websites. So it just depends if they would like to. I can do it. If they want to do it personally, they can do it. However, I do often tell them, if you're going to have sex with this person again, it's probably a good idea to tell them personally, because you want to be able to later say, did you get tested? Did you get treated? But if you're not going to see them again, if there's any fear of violence or anything like that, then going the anonymous route is a better choice.
Yeah. And I think you raise a good point there, Nay, in terms of that, making sure that those partners are being tested and treated, particularly if you're staying in a relationship or staying with those sexual contacts, because we don't want to see people reinfecting each other, which is what we have seen before, and something that could have been prevented by a simple conversation. And when we're doing the health promotion and education, we're often talking about having those conversations as part of a healthy relationship. So if you're in a healthy relationship with somebody, be supportive of each other, go and get that sexual health checkup done together so that you know each other's STI status, and that hopefully if one of you tested positive and you were in that healthy relationship, it's all about that communication and respect and being able to have those conversations with partners regardless. So and do it in public, because you're not going to get as bad a response than if you do it in private.
I haven't heard that idea, actually.
It's like get a dodgy chocolate milkshake thrown at you in a cafe after disclosing that you've got chlamydia. Okay, next question. So, are cold sores a type of herpes?
Oh, this one is all, so I already cut you off. I'm like,
no, but I'm like, what do we need to know?
It's the famous question. Where's my herpes?
Where is herpes?
Here he is.
Oh,
Here
he is. He looks like a little ray of sunshine.
He does, but he's not a sunshine in my life. He is the cause of many a distressed phone call from my patients. Look, so it's a great question. Herpes has so much stigma attached to it. There's a lot of fear around herpes. That's so unnecessary. Herpes has two types, type 1 and type 2. Type 1 is typically the cold sore, okay, and 80% of people, they say, have cold sores. So it's not something to be ashamed of. It's super, super common. It is belonging to the herpes family. The things to be aware of when it comes to herpes, type 1, the cold sore, is if you have an active cold sore and you perform oral sex on someone, you can actually inoculate or infect or transmit the type 1 cold sore to their genitals, and they can have a really nasty outbreak in their genital area. Typically, type 2 is what lives in the genitals. But again, because of oral sex, every now and again, I have patients with a big outbreak down below. That's a type 1, the cold sore, and a nasty bunch of blisters all across here, which is the type 2. However, the good thing is that if you do end up transmitting type 1 to someone's genitals, it doesn't really like to live there because its normal home is up here. This is sort of its vacation. So it doesn't normally live there. So you won't see it very much recurring because it's its vacation. So it won't appear very often there because it doesn't like to live there. So you won't get as many recurring outbreaks. However, type 2, that's the typical genital herpes that we see. That can have the recurring outbreaks in the genitals because that's where it likes to live. So I think it's about 1 in 8 people, they say, have genital herpes. So that's really common too. It's just no one talks about it.
Yeah. And is it true that somebody can actually have it present for quite some time before they even get the outbreak? And I guess that's what causes some of those stressful phone conversations, because I know when I was in the counselling role, somebody in the relationship would have a genital herpes outbreak and they'd automatically assume that the partner had cheated on them. But it was trying to have those conversations about how it can lay dormant. Is that right?
That is exactly right. It can sort of lay in that dormant stage before you get your first outbreak for a fair time. Like we're talking months and months and months at least. And it can cause some distress in new relationships. They think, oh, that's it. You gave this to me. You did it, or you cheated. It causes so much finger pointing. Unfortunately, there's no evidence that that's the case.
Yeah.
So it is hard for some people to understand that.
Absolutely. And I think in my clinical experience, it was often harder to give somebody a herpes diagnosis than a HIV diagnosis. And those psychosocial impacts that diagnosis of STIs can have on an individual, we really can't underestimate how they might respond, and making sure that they know about the social worker through like the Illawarra Shoalhaven Sexual Health Services. So if you do have people who you're working with who have been diagnosed with STIs, making sure that they're getting that psychological support if it's needed through either the social worker at the clinic or through a private psychologist if they choose to disclose that information. But I think herpes is definitely the one that caused a lot of that psychosocial, and like you say, the stigma that's associated with having an STI. And is it true that you still have to disclose your herpes status to partners if you know that you have genital herpes?
So to the best of my knowledge at this stage, it is still something to disclose, which can be quite heartbreaking for some people. But I mean, at the same time, like we said, 1 in 8 people have herpes, and a lot of people actually have herpes and have never had any symptoms. So they actually have it already. They just don't know. So,
and I think that's about working with those clients and giving them the education and empowerment to then pass on to their partners to reassure them that this isn't the end of the world, that I guess they think it might be when they're first diagnosed, and be able to work with those clients on how to have those safe and supportive conversations with their sexual partners. Because again, like Nay said before, we're sex positive and we're trying to break down that stigma and discrimination associated with STIs, and we do want people to go on and have positive, meaningful sex lives despite some of these, what I like to call, little road bumps in their sexual journey.
And I think I like to remind, any of our HIV patients or any of our herpes patients, I always remind them this diagnosis is 1% of who you are as a person, even less than that. There's so much else about you. Like at the time of diagnosis, it feels like everything.
Yeah, true. And it's something that you grow to live with. And I think all about education and knowing what information you can share with partners to reduce, I suppose, that concern. But you're so right, it's not about being defined by a diagnosis. And we say that too, I guess, with the atypical behaviors of, say, autism and Asperger's. Like, you're not defined by a diagnosis, you are who you are as a person. And I think that's a really beautiful thing to bring up, Nay. Okay, how are STIs prevented?
How are STIs prevented? It's a really great question. So we've already kind of talked about PrEP already, as in terms of HIV prevention. So that's really great. That's a really good one that I always like to touch on. Of course, we always have condoms. Condoms are always a great fail-safe. They're really fantastic. You have the male condom as well as the female condom, or the external versus the internal condom. Condoms are cheap. We do have a slide about that a little bit later, so I won't waffle on too much about that. Condoms are great. Another way to prevent STIs is also getting tested before you enter into a relationship. That's a really great thing that we've already touched on today, as well as just adding in the routine testing. So whilst if you're getting your testing done as regular, you can pick something up a little bit sooner than if you let it go or never get tested. And whilst picking something up sooner is not really preventing an infection, it's preventing it for someone else that you might sleep with in the future. So those are some really great STI prevention methods. Would you add anything to that?
I think just that importance of contact tracing if somebody has tested positive. So that's basically just giving those sexual partners a heads up and encouraging them to go and get tested, because particularly with chlamydia, as Nay mentioned before, most of the people testing positive with chlamydia at the clinic wouldn't be presenting with signs or symptoms. So somebody might be out in the community not having those signs or symptoms, feeling like they're healthy, and if they haven't been notified that they're a possible contact, they're just assuming that they don't have anything, yet they're actually potentially putting a lot of people at risk. So I think adhering to that contact tracing as a prevention method as well is really important, and that if you have had the phone call or a text message as part of a contact, to make sure that you're following up and getting that testing done.
Oh, absolutely. I
well.
have a few patients that think it's a joke.
Yeah.
And then 6 months later they come in and go, I've had some problems. So yes,
I got a message
follow up.
6 months ago.
Yeah, please follow up. And I mean, the worst that's going to happen is you get a test done. So always follow up on any text you receive.
Yeah, and just like Nay's just mentioned, testing's often really simple. It's often just a urine screen, which most people have done in, part of their routine health checks, and they know it's private and confidential. Other than that, potentially a blood test. But I mean, how many patients would you see, Nay, in say a week, and how many of them would you actually have to look at their genitals with STI work?
Yeah, not that many. Most of the patients I see have no symptoms, so simple urine test, depending on their activity, swabs, and a blood test. But yeah, very little of them do I have to look at their genitals, and we only look at their genitals if they give consent and if they have symptoms. So if they don't have any symptoms, I'm not going to see anything that I need to. That I'm not going to see anything if they're not seeing anything for the most part.
That's right. Yeah. And I think that's a really important message to get across to the people who you're working with, is that quite often you're not showing your genitals, because that's why people might be hesitant to go and get a sexual health screen done around that privacy and potentially taboo of having to show your genitals, which is not the case. So great prevention tips there, Nay. So testing and condoms. And I think we're about to go into a question about condoms.
Yes, we are.
So we don't actually have time this morning to go through condom demonstrations for you. You can, however, find demonstrations of both the internal or female, external or male condoms on our Caddyshack YouTube channel. They're great little clips that you're able to show to the people who you're working with on how to use a condom correctly. But using a condom, it's just as simple as 2 steps, right?
You'd think so.
Most of the people who we work with think that's the case, but is it really?
No, it's not. No, it's not. It's not the case. There's a lot of steps. You'll have to remind me if I'm always trying to be the best, but every now and again I miss one step. The first step we always encourage is for people to actually make sure they've got consent. The consent from the partner that things are going to go ahead. And that's really important. We can't forget about consent. The next step is to actually get your condom and have a look and make sure there's no imperfections. You want to make sure there's no hole in it, that it's not already been, it's not expired, there's expiry dates. Then from there, you always want to make sure that if you're opening it, you're not getting a big pair of scissors or ripping it with your teeth. That's a really common thing.
Or long fingernails if you've got acrylic nails.
Yeah, just checking on that. Depending who's, sometimes a partner may want to put the condom on the other person, so you could just check on consent again there. You happy if I do this? That's really great. In order of to make sure you're using the condom properly, one common mistake that a lot of people make with condoms is they pop the condom, if we're talking about external condoms at the moment, so male condoms, they pop the condom on top of the person and go, oh, that's the wrong way, and then they flip it. And that condom is probably now got some pre-cum on it, and that can actually have STIs in it. And now you've just flipped it and it's probably going to go inside. So it's really great that if you put it on upside down the first time, just get another condom. So just do that, making sure you're pinching the top of the condom and you're then rolling it down. So that pinch is really important. No doubling up condoms. I get that question a lot. Don't double up. Can increase friction, and then you can get them both broken. And I feel like I've stopped. You want to check as well that the person consents before you go ahead one last time, to make sure they're okay.
And all condoms sold in Australia come pre-lubricated, but we do recommend the additional use of a water-based lubricant. Really important to use a water-based instead of an oil or a silicone base, because condoms are made out of a fine latex rubber and they do disintegrate really quickly. So I guess some of those common mistakes that people make are not squeezing the tip, therefore it's more likely to break, or not using enough lubricant and then also leading to a potential breakage. Lubricant is particularly important for any type of anal sex because the vagina and mouth are somewhat self-lubricating, but the anus is not. So that water-based lubricant is really important. What Nay has just spoken through is a form of what we call the condom continuum game. If you haven't already, jumping onto PlaySafe Pro as a worker, there's a whole suite of activities that can be done in there. It's about engaging with your clients around condom use and sexual health. The condom continuum is one of those activities, so you can check that out. Also through PlaySafe Pro, you can order for your service. If you're on Jen's email list, you would get these emails regularly, but you can order 144 free condoms through PlaySafe Pro. We also have our condom dispenser project. There's 77 services across the Illawarra and Shellhaven who are currently part of that project. That means that they get condoms provided from us here at the Heart team free of charge, and they have those in their service. If you go to our webpage, the caddyshackproject.com that Jen's put up in the link there, you can actually see a local services map. So you can direct your clients to the nearest service that have those free condoms. So not being able to afford condoms is not an excuse for not using them, because we do have lots of opportunities to get free condoms out there in community. And I love so much that you touched on consent, Nay, because I think that it is something that is often overlooked with condom use, and it's the fact that we do need to make sure we're getting consent of all parties involved in those sexual acts. And we're really happy and excited to be holding a webinar with Consent Labs at the end of July. So given how topical consent has been in the media at the moment, we're really looking forward to that presentation from Consent Lab and seeing what it is that they have to say and what messages it is that we can then be sharing with the people who we're working with. So if you're interested in consent, which most of us are, please feel free to jump onto caddyshackproject.com and you can have a look at our upcoming training calendar and register for Consent Labs in July. We are coming towards the end of our session this morning. So if any of you have any questions that you would like answered, please don't hesitate to pop them into our chat box. If you would like, you can also come off mute and ask directly. I think we've covered a fair bit this morning, so thank you so much for joining us. We will have follow-up links. If you want more detailed information, you can order resources from our free resource order page on Caddyshack Project, and there are a few of the STIs that we go through in specific detail in those postcard resources, or going to PlaySafe or family planning and having a look at their STI fact sheets that are available as well.